right, so I'm recording now. Yep, 204. Both of these are recording. Okay. They ain't gonna see me. Devil man. Okay. So let me see. You're straight. Let's fix this. Hold on. Yeah, you're straight. Okay, that was just me. Okay, so tell us who you are and what you do.
So my name is Jamika Muhammad. I am the founder of Anointed Hands Wellness. We are a physical therapy clinic, but kind of transition lately more to wellness because we want to kind of get outside of the thought of rehab to prehab. So we kind of want
Prehab. So that's, did you make that word up?
No, that's actually a word.
So what is prehab? Tell me what prehab is.
So when you think of rehab, is happening after something bad happened. So injury or surgery, or you tore something. So you're rehabbing to get back to where you were. What we're trying to do is catch patients when there's a first little tweak, or if they're out of alignment, if they have bad posture, if they have some weakness. We want to help you identify what those things are in advance, so you can almost like bulletproof your body so that you're not prone to those issues. Because we're all prone to different things the way our structure is, the things we like to do, the way we like to sit. Like some people like to sit with their leg up under them. Some people like to sit with their legs crossed. However, whatever your preference is, you are creating weaknesses and tightness just because of things you prefer to do or things you've always done. You're creating imbalances in the body. So what we want to do is have you come in, identify what those imbalances are, see the things that you prefer or like to do, and then start making adjustments. Because if you don't make those adjustments, then again, they're going to make you more prone to injury or pain or different things just because everyday living.
So what I hear, you like the anti-lazy person.
Kind of the anti. And it's not really about being lazy or not. It's really
You don't
not.
think so? You don't think that, because me hearing you talk, it sounds like a lot of this is caused by people who aren't active. Like if you're not active, you said it's trained. That's not it?
No,
Well, give me
that's
the
not.
difference.
Okay, so that's what people think. So I'm gonna give you an example. I have a patient that came in. She is a retired nurse, but she still works PRN, so she's still moving. She is very busy in her family, so she's taking care of husband, grandkids, out. In addition to being retired, quote unquote.
Okay.
So she's busy. She helps people move. She will do anything that she needs to do. However, she had to end up having knee surgery. And most times people think, oh, when I have knee surgery, then I'm good. I had the surgery. So they fixed what my problem was, which isn't true. So we're her second physical therapy place because the first one wasn't providing what she needed because they're just working on strengthening and range of motion. But in educating her, I was like, well, we can do all the strengthening and educate and range of motion that we want. However, if you don't change your structure, so she has what most people will call kind of knock-kneed, but it's called genu valgus. And so
It's called who?
Genu valgus.
Okay.
So that's the knees coming in and then going out to the ankle. So the hip is here, knees.
So
and
when
you
the people
see-
are built like that, you're not supposed to be built that way?
You're not supposed to.
Really?
So that's the difference.
Ooh, I've
so it
seen
doesn't
some
happen.
people like that.
We've seen some people like that.
I didn't know that.
Yeah.
Oh.
You should be hip, knee, ankle in a straight line over each other is ideal. Most times people are either bow-legged, not good either.
That's not?
No.
Oh.
Or they're knock-kneed.
So can you make somebody not knock-kneed?
You can give them things to lessen the knock-kneedness. So depending on how old they are, how long they've been in that position, some of it is simply due to your foot being flat. So think if your foot is flat, then it's going to make your knees come in. just by the position of your feet. So sometimes we can improve it by just giving you orthotics or working on building that arch back up in the foot, and that will then align everything all the way
So
back up.
you're saying in what you're doing now with this lifestyle and prehab, you're saying people's natural way of being is throwing them off and they don't even realize it.
And making them more
Other
prone
pain.
to injury and causing pain.
So can you tell just about, like if somebody came in your office and just walked, could you tell what's wrong?
Yeah. So
Really?
I was out with my other therapist that works there with me, and we went and grabbed lunch. And as people were walking in, we were just like, and we're not working right now. We're not working right now. Because yes, just people walking, you can pretty much tell where they're having pain.
You should do that, like Anointed Hands, the catwalk every Friday. That'd be fly.
That's nice. Yeah.
If they just came in, tell them just
Let's
do
do the catwalk.
runway, do a walk, turn, walk, and then like you give them like a thing.
That's a great idea.
Because I didn't
We might
know
have
like
to do
walking that you could tell.
Yeah.
Like how many steps you gotta do before you can tell something's
So
wrong?
I have a shirt that my daughter bought me because she's been around me quite a while, and it says, "I'm not checking you out. I'm analyzing your gait." And that's often I'm always like, I wonder what's going on with them. Why they walking? I wonder if it's their hip or their knee.
So now we're gonna talk fashion. Okay. So since you know about walking and stuff, what about red bottoms and posture and all that? Is that like the thing? Are cheap shoes bad? Tell us about that.
Not necessarily that cheap shoes are bad, and it's not necessarily that expensive shoes are good. We do have a lot of clients come in and they're like, "Oh, I got Brooks. These are great shoes and blah 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 blah." I'm like, "Okay, where'd you get them from?" "Oh, I just went to Dick's," and I'm not knocking any store. "I just went to the store. I grabbed them off the shelf and they felt good, and I put them on." And I was like, "No, that's not how that works." Because Brooks, although they're good shoes, and there's so many Hoka's good shoes, so many good shoes out there. Just like a car company, let's use Toyota. They have Corollas, they have trucks, they have SUVs. You have to find which one is your fit.
So you can't just grab a shoe.
You just can't grab a shoe.
I didn't know that.
Yeah. So if you go in and and I know your shoe game is tight.
I didn't know that.
And I'm often looking at your shoes and I'm like, "Ooh, those nice." But I bet you they don't have the support
Oh, man. So you're saying it's different models.
It's different models to all shoes. So you can't just go in and pick a shoe off the shelf. You got to make sure you got the model that's for flat feet, that's for the right instep. If you toe off, it's a whole bunch of different
Hey,
things.
look, I'm telling you, your content, I'm hearing it. Do shoe reviews. If you flat foot, this the Brook model, this is this. I strongly recommend not being paid.
You know what? There's even more detail than that. There's places you can go and you stand on their
Oh, the little machine.
you stand on the
you're feeling?
machine and it tells you where your weight bearing is.
Take the camera with you and do it a cell phone.
I should. Yeah.
Because the shoe game, like shoes are like, people are always looking for real reviews of shoes. And if the shoe is so important and technical, take somebody on a journey with you. I'm going to purchase a pair of shoes for myself and somebody else. Let them do it.
Yeah.
And like, if you're not sure, come by the clinic. Let me come to Catwalk Fridays. Walk for me. Because I didn't know, like you're blowing my mind. I didn't know, like, it's the shoe, it's the walk. So wait a minute, now we got to talk about BBLs.
Okay.
So do BBLs throw your balance off?
Well, yeah, it can. Yes. It definitely can. It can also change, not necessarily balance, but if you're taking quickly things from one place and like anterior and putting them posterior, right? There is going to be a shift because before you were carrying your weight in a different place. So there is going to be kind of a,
So you're telling me BBLs can mess your posture up?
Oh, 100%. They can mess your posture up. Your posture could already be bad. It's more than likely already bad. I would say, and not trying to be, what I've seen most people who get kind of like that type of thing, they're trying to get like a bigger butt. And so in our community, when you try to get a bigger butt, if that's your goal, you've already changed your posture to make your butt look big. And so
like arching yourself.
by arching your back. So if that's your goal, you've probably already been doing that over time. So now you already have bad posture because your lordosis is going to be accentuated. Your lordosis. And so that's the angle of the lumbar and the sacrum. And if it's too much, that's going to just increase your back pain. And then when you get that BBL, it's making what may have been a difference of this, now a difference of this. And so that slight little angle here is now more pronounced, which will give you more back pain.
So we going to see a lot of challenges 10, 15 years from now.
Yeah, with people with low back pain.
Because of that.
Yeah.
Oh, man. So what about heels? Now talk to me about heels.
Heels aren't the worst.
They're not?
They're not.
Whoa, are you sure?
They're not horrible. You want to, so I'm short, 5'2". So I like heels. I think they're appropriate during appropriate times. Yes. For myself, if we're going out, I will have on a bad pair of heels that are very uncomfortable. However, as soon as we get to the car, I am taking them off and putting in something. So
what's up with that? Why do people do that? Like, why do women do that? Break that down. Come on.
Heels are uncomfortable. But, so most times you got a tall heel and you have a narrow toe box. That means your toes are being squeezed.
Yes.
So let's think about that. Your toes are being squeezed, so then your pinky toe, which should be out here and providing you some support, and your big toe, which also provides you support, are now squeezed together. So now your support is just through a little bitty space when it should be spread out. Doing that 24/7 for my women who wear heels all the time is not good.
If they design a shoe like that for men, we not buying it.
You're not. So, like dress shoes for men, there are some, kind of dress shoes that go in. There's a smaller toe box.
I think it's the squeeze of the toe and the up.
And the up.
Because it seems like, men notice some women can't walk in heels.
Yes, you can't.
They look like linemen. Like they play for the Bears. So when how do your daughters wear heels?
Not really. Not too much. They don't.
Have you showed them how to walk in them?
No, because they're not really one isn't interested at all. Two, she's 24, so she's, outside of learning. She's doing what she wanted to do. The youngest one now, she's had foot issues forever. And we kind of identified that when she was a baby because she would always be like, my legs hurt, my legs hurt, my legs hurt. We went to the zoo, museums, any type of long walking. She would just complain of her legs hurting. And then one day when we were trying on shoes and I was like, my mom hat came off and my PT hat went on. I was like, well, that's why her feet hurt. And so we've started giving her orthotics. So now for her, because she's had orthotics, she understands because I have taught her, the importance of good shoes, cheap shoes, good shoes. When you have your flip-flops on, just know they're not giving you any support.
Say it again.
They are not giving you any support.
So anti-flip-flop. You can't even articulate.
I am pretty much anti-flip-flop.
What about slides?
If they have an arch, or if you can put an arch support inside of them, okay. But then if they don't have a back, they won't stay in.
So what's the point of a flip-flop? If it's no support, you're out. Is it fashion? Like what's the point from when you said a flip-flop? Ease.
I think it's ease. Yeah. So I may wear a flip-flop. I have flip-flops. I will wear them kind of around the house, or if I'm going to a pool and I don't want my shoe to be wet. I need time to dry it. If I'm at a hotel and I got to stand in the shower, I wear my
flip-flops. Okay, that's sanitation. I get that. Yeah, because you in the shower. Right. Yeah.
If I'm going to get my toes done, I will wear my flip-flops, but I still have my shoes in the car that once the toes dry, I'm going to change into. But for a prolonged activity where I'm going to be doing a lot of walking, a lot of standing, I would never wear a flip-flop.
$1 million question. You ready? Crocs. What's your stance on Crocs? Come on, PT. What's up with the Crocs? Like, is that gonna help my ankle? Because these kids live in Crocs.
No, they will not help your ankle. There's no ankle support in Crocs.
What about posture? Like,
now, they do have a decent amount of support inside the arch. So it gives you some support in your foot when you have them on. Again, it's nice if you're gardening or you're going to be outside playing and your foot's going to be wet, but you need something on your heel to keep the shoes on. That's the other thing with flip-flops. You have to do this to keep the flip-flops on your foot.
oh, you got to move your toe like that?
Yeah.
Oh.
Because
That's
when
not
you
good?
walk, oh,
Really?
this isn't neutral. You always want to be in neutral. So when you have on a regular shoe, the flatness of the shoe gives you the support. When you have on flip flops, you kind of gotta keep the flip flop on your foot. So now you're flexing the toes, which could cause some issues other places. So again, flip flops long term isn't a great idea.
So what's the so you're talking about I wanted to talk about this because you mentioned something. Back in the day, they used to make babies wear those hard bottom shoes. Is that still the case, or no? What are your thoughts on the type of shoes kids should wear, babies, like when they start to walk?
They need something with some support.
The old school hard bottoms.
Yes, but they've updated them now. They don't look so hard.
What brand? What brand would you recommend?
I don't know. I haven't. My youngest is 16, so I haven't looked at baby shoes.
So you're gonna get back to us.
Okay.
Because people need, I'm telling you, they need to know what to buy.
What they need is something, not these little cute shoes. Cute shoes are for when they are in the stroller.
When they can't walk.
Or they're in the stroller. If you are trying to get the child to walk, they need to have on some good firm bottoms. So they don't have to be hard bottoms, but they do need to be firm, flat. They need to be tie up above the ankle to give support. So that's the thing with the Crocs. It doesn't support the ankle. So, you got a lot of people wearing Crocs with limited stability and then break, tear something.
See, you talking, it's good because like I think that people need to hear this stuff because that's old school wisdom. Like, because these kids wearing Jordans, can't even walk. They wearing all this designer stuff. Yeah. And you're saying they can mess their gait up and their support?
And I love Converse. I want a pair of Converse so bad.
You mean All-Stars?
Yeah.
What? I would think that'd be bad for you. Those are
It is. But I still want one. I think they're cute. But I don't have them because of that reason.
The worst shoe.
They're too flat.
So next time you come, we're gonna have a list. You're gonna have your top 5.
Okay, well you gotta give me the list in advance.
Oh yeah,
and then I can be like, okay.
So look, we're gonna do top 5 shoes for women, top 5 for men, top 5 basketball. I want lists because then we can go try it out and see. Yeah, because that'd be good. Now let me ask you this: what about clothes? We're gonna talk about clothes now.
Okay.
Is there, what do you think about Lululemon? That is like $200 for some stretch pants. Do those help at all or just fashion?
I think it's more fashion.
Really?
I think it's these are Lululemon. Now, I don't have a pair. I've been in the store. It's outside of my budget because I was like, I'm going to sweat in this. I can't pay this much money for something I want to sweaty in. I'm not putting the clothes on to be cute. I'm using them to work out.
Do you have a preferred thing that you like? So when you're picking out stuff to work out in and be active, is it price point? Is it brand? Is it one that you prefer or you don't care?
I really don't care. I don't have a particular brand that I like or dislike. Again, when I'm working out, I like to go hard in the paint, so I don't really care what I.
So next time
like.
you come, we gonna have you. We gonna because people gonna watch me like, okay, she said we trying to get you an endorsement deal.
Yeah.
So if it's something that you like, rock it. This what I like. This what I wear. Whatever you want. These my top 3 because lists are popular.
Yeah. Yeah.
So, what about? Let me see. I ain't even look at the time. Nah, we got 5 minutes. Okay. So I just gave you about a month now. You got some good stuff. Okay, so now I want to ask you about music. How often do you work out?
5 to 6 days a week.
Really?
Yeah, doing something. So my thing is, even if you have a short period of time, you should be doing something to build muscle. Build muscle burns fat. Cardio is more heart healthy, but muscle burns fat. So most women go in the gym, they're like, oh, I don't want to do weights because I don't want to look bulky. You got to do a lot of cutting and a lot of weight lifting to really look bulky or look like, like a women's bodybuilder, right? You got to do
this, like that.
You got to do a lot. You got to do a lot. So
it won't just happen.
It won't just happen. So don't be afraid of weights. So I am usually, because I don't have a lot of time, so I will do, when my time is really short, I'm like, okay, 50 burpees in 5 minutes.
That's 50 in 5 minutes?
50 burpees in under 5
Then after
minutes.
that you pass out? What do you do?
Then I'll go to something else.
So how much, and these active people, everybody's so active, how much time working out do you, like in a day, what would be sufficient? What's minimum? Because like if I said, hey, like it's a weight room right down the street. If I went in there for 20 minutes, 30 minutes, 5, like what's the minimum for me to have something decent? And how many exercises?
If you're consistent, it doesn't take a lot of time. You don't have to be in the gym all day.
You could do 15 minutes?
You could probably do 15 minutes.
And how many
15 minutes will help you maintain. I'm not going to say 15 minutes will start to make changes, but 15 minutes will definitely help you maintain and probably even start cutting if you haven't been doing anything or if you've been doing 1 or 2 days for an hour. Because for me, I feel like, those long times, there's a lot of rest in between.
A lot of rest.
There's a lot of rest. There's a lot of rest in between.
Okay.
So I can go in the gym. If I go to the gym, I'm going to spend a little bit longer time because I got in the car and I went to the gym. If I'm at the house, then I will, like I said, I'll do the burpees or we have stairs. I'll run up and down the stairs without stopping 10 times.
That's cardio though, right?
That is cardio, but I am up and down the stairs.
Okay.
So it's cardio, but it's also some strengthening because, but then after that, then I go to the weights. So I've got my heart rate up. Now I'm going to do weights.
So here's something you got to talk about now. The older we get, talk about the importance of warm up. Because some folks don't warm up. They just
warm up and cool down. So even more so than warm up, I would say cool down. So if I'm at the gym, again, if I'm at the gym, because for me, going up and down the stairs at home, that's my warm up before I start lifting the weights. That's my warm up. If I'm at the gym, I'm going to get on something cardio, whether it's the elliptical, the bike, the treadmill. I'm going to do something for 5 to 10 minutes to warm up.
Oh, so you're saying using an elliptical to warm up with a thing. Okay, got you. Okay.
At a kind of, interval, right?
What heart rate you trying to get to with the warm up?
Depends on what I'm doing.
What you're doing. Because I know some people, everybody has these Apple Watches.
Right, and it will tell you.
And it tell you, so, I've heard, you can correct me on this, that some people aren't warm enough. Like their heart rate is not,
high enough.
Yeah, they'll do something. But it's like, is a rule of thumb you should at least be sweating?
For warming up? Not necessarily. No,
Okay.
You don't have to sweat. You just want whatever muscles you plan on working that day to have some blood flow and circulation. So think about if you're on work legs and people walk on the treadmill, but you're just walking. Walking doesn't use a lot of muscles.
Depends on how heavy you are, right? If you're heavier, does walking do more? It don't matter. So if you're light or heavy, it don't matter. Walking ain't it.
It doesn't use a lot of muscles.
Oh, it does something, but not muscles.
Right.
Okay.
So a limited amount of muscles are using just to walk. So I often get, I move around. I never sit down. I'm always walking. I'm like, okay, that's not exercising. That's just moving. You don't use a lot of muscles to take a step, right? But let's say you're on the treadmill, again, or the elliptical, which is why I prefer the elliptical, because you can go up and down. You're taking longer strides than you normally do. So you're actually using more muscles.
Okay, so what's on your playlist when you're working out? Top 3 songs.
I don't have to.
Tell the people. Don't
I don't
gatekeep.
have. No, I don't have any top 3 songs. I can go to the gym and not listen to any music.
So you don't
at
have
all.
a playlist?
Mm-mm, I do not.
What?
I do not.
Why?
I got too many. I got too many playlists going in my
so
head.
you don't need. So some people when they go to the gym, they leave their headphones. It's over with.
Yeah, no, I can
It's
have
not-
my headphones. I cannot have my headphones. It doesn't matter.
So you don't care.
I don't care. I don't. It doesn't matter because usually I have so many thoughts going on. It helps me kind of process through my to-do list when I'm, working out.
So what? Last question for you.
Wait, let me go back.
okay.
You asked about, in the gym minutes, right? So the thing is, you want to kind of do. I can't think. They have a name for it, but I'm gonna call it. I'm gonna say like intervals, right? So you want to go hard, and then you want to find something that's. What's the name? I was talking about it on my podcast a couple
Is it
weeks
high
ago.
intensity training to hit stuff?
Not hit, but set, superset.
Oh.
Superset. So you want to alternate something heavy and something light. Something heavy and something light. There is no rest.
Jesus Christ.
Right? So if I'm working legs, I'm going to go to something hard and then I'm going to go to another. So I may do adductors and then I may do abductors. So I'm going to superset between the two. And so there is no rest. Or do some core or do a plank in between machines.
So if somebody want to learn how to work out, that's not your lane, though, right? Like if you go in there and is working out prehab. Like, okay, let me back up. If they walking and they're off and you noticing their gait is off, do you suggest workouts to fix it, or what do you suggest to fix their alignment?
We suggest exercises to fix it.
Okay, and then you do it with them there.
Mm-hmm.
And then they have to do it on their own, and then that fixes the walk.
So we make them aware. So most people aren't even aware of what they're doing. So let's go back to that nurse. She's genu valgus, and she says, every time I leave here, I feel good. Then I go home and I do the stairs because you told me to exercise on the stairs. When I do the stairs, my knee starts hurting in this same spot all over again, and it gets tight. I'm like, that's because you're going up the stairs the wrong way because as your form. So when you're in that position, you're putting pressure medially because the knee is going here and coming out. So the pressure's going right here where you're having pain. And so you're putting pressure there because of the alignment. It doesn't have anywhere else to go. And so now you put in that pressure, the knee starts to hurt, it's going to start back swelling, which gives you that tightness because you're re-injuring it every time you try to do your exercise. So that's the problem. People go to the gym and they're like, oh, I was doing this and I was doing that. It's like, but yeah, but I don't know why I'm still in pain because you're re-injuring yourself, micro injuries, while you're trying to do something that you think is correct, but you're re-injuring the thing. I said, so now when you go up the stairs, maybe you only go up 2, but do it correctly versus going up
It's that
10
form.
times. It's the form. It's the form. Form is everything. And if your form is off, you're causing yourself, you're creating a space where you can get injured.
So what about massages? How often should people get? Is massages because of bad form? Like, do you naturally need massages, or is it because you're so out of whack?
You will naturally have muscle tightness, and more likely because you're out of whack. Because of your structure, there's going to be things that are tight. There's going to be things that are weak. You're going to have muscle spasms. Everyday living, you're going to have muscle spasms. Because if you're working, you're forward, your head's rounded, you're on the computer, you're doing this, you're driving, you're forward. Everything we do in life is forward. So a lot of things we teach people is trying to come back and just being more aware of your posture. So yes, you will always have neck tightness and soreness because you're not doing anything to make it relax because you're overusing it. So yes, is massages always good? more than likely everybody can benefit from a massage because everybody has muscle tightness.
So everybody I know, lower back, like my lower back be hurting. So what is it you can do regularly to decrease lower back tightness?
So on our Facebook page and
Yeah,
on our
tell 'em.
YouTube channel, we have exercises that we go over, and for
For lower
low back
back.
pain, for shoulder pain, for ankle pain, here's some stretches that you can do to alleviate the pain. We talk you through it from a PT perspective. Make sure you're not doing this. If you feel this, you're feeling in the wrong place. So to give you cues as to what to do. So some of my favorite is my top 3 favorite is
Here we go. We got a list. Here
got
we
it.
go.
We finally got a list.
Got a list. Lower back list. What you got?
Low trunk rotation, which is you're dropping your knees from side to side. Pure form stretch or figure 4 stretch, where you bring your ankle on top of your knee, pull it up to your chest. We'll pull your knee up to your chest, or you can lean forward, kind of. And then the other one is 3-way hip stretch, which is hamstrings. Most often, if you have low back pain, your hamstrings are tight.
That's me.
And if your hamstrings are tight, you will have low back pain.
Oh, news you can use.
They kind of boop, 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 go together. Yep.
Okay.
Yep. News you can use.
There we go. So thank you for talking to me. You did fantastic.
Thanks.
We're going to have some lists next time. So go ahead, do your job. This is your camera. Look at your camera, and you're going to use this for other stuff. So I want you to say stuff like, hey, Jamaica Muhammad, Anointed Hands, thanks for watching. And say, hey, watch our Facebook page. We got more clips, more tips. Just like your drops. You know how the radio station, when people come in, they say 107.5, where the hits are, this and that. They do drops. So do some drops for yourself.
Okay.
Yeah.
Jamaica Muhammad, Anointed Hands Wellness, where we help you rehab, recover, and restore your body to its natural function. Make sure you check us out on Facebook, Instagram, TikTok, and YouTube. On our YouTube, we're giving exercises for all parts of the body that you can follow along with to help you feel better, decrease your pain, decrease your tightness, and just become more aware of your posture and position in everyday life, as well as check out our podcast that we do with different healthcare and wellness individuals to get their aspect and their viewpoint on what does wellness mean. It gives you a few tips on throughout your day that you can incorporate to move better, to think better, whether it's physical, emotional, spiritual. We're covering all of that. So check us out.
You got to do it again. Do it again. Now, this one, I won't. Sure. I won't.
Okay.
I want you to connect and get out.
Okay.
Are you in pain? We can help. Watch our podcast, tips you can use. I'm out.
Okay.
People attention span ain't there.
Okay.
You doing dissertations. They ain't got it.
Okay.
So you got to connect to where they are. They probably in pain. Do you feel like you could be in better shape than you are? Muscles a little tight? Watch us for tips, inspiration, and entertainment. Boom.
Okay.
See that? You remember that.
Okay.
Because you said something that I am. Come on.
Okay.
Give it to him.
Jamaica Muhammad, Anointed Hands Wellness. Are you experiencing pain, discomfort, or just want to prevent your body from having pain later on? Check us out on our social media post. We give you tips, inspiration, and a little entertainment to help you feel better, move better.
Very good. That's better. That's a little better. Did you enjoy that?
That was fun. I need to come here